Hello, my name is Dr. Frederick Covington, and I'm a pediatric occupational therapist. Welcome to another edition of OT to Me. Today, we're going to talk about backpack awareness. Now, more than 79 million students in the United States carry school backpacks. For those of us that have children or work within the school system, seeing children loaded down with heavy book bags or backpacks is all too common. Seeing these children, some as young as 6 and 7 years old, carrying bags heavier than their frames can manage can have several detrimental effects on their overall health, growth, and development. Now, according to the U.S. Consumer Product Safety Commission, backpack-related injuries send an estimated 5,000 children a year to the emergency room. Now, more than 14,000 children are treated annually for injuries. Today, we want to discuss the possible side effects of carrying backpacks that are too heavy and what we can do about it as parents, educational professionals, and health professionals. So, let's discuss the ill effects of carrying heavy backpacks. 1. Damage to muscles. Heavy backpacks can strain the back and stomach muscles when worn improperly. For instance, when wearing the backpack up too high on your shoulders, or when it's worn too low and is sagging when you're wearing it loosely. There could be chronic neck pain. Heavy backpacks, when worn over one shoulder, strain the neck muscles and the upper back muscles as well, causing constant neck pain and causing the child to lean to one side. This in turn becomes poor posture and causes damage to the nerves as well as the skeletal system. There can also be damage directly to the nerves and blood vessels. The straps of heavy backpacks can put pressure on blood vessels and on the nerves in the neck and shoulder of the child, causing pains in the hands, arms, and neck. This can lead to feelings of numbness in the areas where the nerves and the blood vessels are experiencing pressure and can radiate outward from the point of the pressure. There can also be decreased lung functioning. Carrying heavy backpacks causes children to lean forward in order to balance the weight of the bag. This in turn, again, leads to bad posture. This bad posture also causes decreased lung functioning and breathing difficulties in some children. This has been seen in children who carry bags heavier than 10% of their body weight. Now, there can also be fatigue and poor bone development. Carrying heavy bags can just totally drain a child's strength immensely. And this leads to them being continuously tired, which in turn affects their ability to study, learn, and to even play. Heavy backpacks can also damage the skeletal system and lead to abnormalities in bone growth in children. And lastly, let's look at accidental injuries. Now, did you know that a heavy backpack can sometimes skew a child's sense of balance and have them tip over because of the weight? Heavy backpacks not only can cause injury to the children who are carrying them, but also to other children who might be hit by the backpacks in crowded hallways or in a crowded school. Now, let's talk about fixing these problems. When choosing a backpack, parents and caregivers should consider the following. First of all, parents should look at appropriate size. Make sure the height of the backpack extends from approximately 2 inches below the shoulder blades to waist level, or slightly above the waist. You want to pay close attention to shoulder straps. Backpacks should have well-padded shoulder straps that can be worn on both shoulders, so when packed with books, the weight can be evenly balanced and distributed by the student. You also want to look at backpacks with hip or chest belts. Now, these backpacks with hip or chest belts take some strain off of the sensitive neck and shoulder muscles and improves the student's balance and helps distribute the weight of the backpack. You also want to look at fit. Just as your child would try on clothes and shoes when shopping, it's important to try on backpacks as well. The right fit for the child is extremely important. We also want to look at weight. Check that the child's backpack weighs no more than approximately 10% of his or her body weight. If it becomes more, to determine what supplies can stay at home or at school each day to lessen the load. If the backpack is still too heavy for the child, consider a bag with wheels. Also, when packing the bag, knowing how to pack a backpack can help with strain as well. You want to place heavy items closer to the back center of the bag. Lighter items go in the front of the backpack and sharp items away from the back. Always utilize different compartments or pockets in the backpacks to distribute the weight. So, with all of that said, we hope that this information has proven useful and beneficial to you and the backpackers in your life. I'd like to thank you for joining us. I'm Dr. Frederick B. Covington, pediatric occupational therapist, and we'll be seeing you next time. Take care.